Hi, and welcome to another podcast from Mishti on diabetes this time around. We are trying to bring you as much educational content as we can around how we can use nutrition, how we can use exercising, how we can use medicine to have a much healthier lifestyle and a much longer lifestyle, both for ourselves as well as our elderly family members. So today I have a great panel with Dr. Pavitra, who is an exceptional diabetologist with over 10 years of experience in the field. She started her training in Fortis and spent time at Lifespan Diabetes Clinic before joining Care on Call, which is where she's most recently working at. And I have to the left of her, Sushma, who is a seasoned nutritionist with experience across multitude of providers, including AIMS in Delhi, VLCC, as well as Personal Point, which was the pioneer on weight loss in India. Her master's in nutrition comes from University of Baroda. We're so glad to have both of you here because I think it's great to have a balance of medicine, Dr. Pavitra on your side, and balance of nutrition with Sushma on your side to bring to the forefront of this particular topic. So thank you for joining us today. So I actually want to start off very, very quickly on a very, very personal question, actually, Dr. Pavitra. What made you join the field of diabetes? That's very sort of, I want to kick off with what's the interest in diabetes from your perspective?
That's a very, very good question because I actually wanted to be a cardiologist, especially interventional cardiologist. And Dr. Devi Shetty inspired me to even get into medicine. What happened was after my MBBS, I did my MSc clinical research. And I thought I would do more good by doing clinical trials and, contribute to the patients. However, I came across my professor, Dr. Harinarayan. He is an endocrinologist, and he was the one, he told me, I mean, you being a doctor, you're not seeing patients. That kind of hit me really hard, and I thought for a while, and I actually felt I was missing seeing patients. And he said, what are you doing now? Are you working somewhere? I said, no, I'm not working. I'm just trying to, figure out what to do next. He was like, come and join me as an assistant. Yeah, I went there, and it was, very easy for me to say. I just went there and I joined. It was extremely difficult to work with him, as he's one of the best endocrinologists of our country. And he is, the way he approached it felt like as if it's very easy for me to work with him. It was extremely difficult. He's a very strict doctor, and he's very particular about things. So yes, I joined, and I did a course under him for diabetes, and I had hands-on experience while doing the course with him. That's how I would actually say, apart from my MBBS, I started liking medicine, and I actually learned medicine from my professor. It was the first time I felt like, yes, this is medicine for me.
This is medicine. It's amazing how a great mentor can really change the track of your career by inspiring you. And Sushma, very quickly on your side, what made you get drawn to nutrition?
Primarily because there were few options in my case too at the time when I was doing masters, when I had to decide on masters. So there were various options, but yes, nutrition drew my attention primarily because I was always interested in health for some reasons. And then I thought but it was not, it is way back in 80s when it was not so much prevalent in India, I would say. And once I did that, and when I went to Personal Point, I realized how much it's required, because they were the guys who brought, he was a sports medicine doctor who had brought a nutrition concept to India in Delhi. Their weight loss and had become such a big phenomenon in Delhi. So everybody wanted to come, join, and that's how the machines came. These certain machines which are put on your specific body parts and which use pulsation as a mode, which is like contraction, relaxation, contraction, and that kind of a thing that moves, and it's kind of giving you exercise passively, not actively. And you do lose on your inches and all that. So that's how the whole concept came. So I was more into the weight loss industry with them, working and trying, and then moved on to the diabetes and other health-related issues from there.
Let's actually kick off with the very first question, Dr. Pavitra. This one's for you. Is diabetes actually a disease or a lifestyle disorder?
Okay. When we say diabetes, most of us, we're like, okay, once a person is diabetic, he's diabetic forever. It's not the same. It's, I would call it a myth. Sometimes, in the initial stages, diabetes can be reversed. Okay, so this is a lifestyle disorder. It's not a disease. Disease is something, which is like some infection you get and then, you cure by antibiotic or something. But diabetes is a lifestyle disorder. So when I say it's disorder, it can be brought into order by making certain lifestyle changes. And, taking adequate medications and, focusing more on diet and things like that, stress management and other factors. So it's very important that, we look at diabetes in a completely different perspective and not call diabetic individuals as patients. I would always prefer calling them as diabetic individuals. They're no way less than, they're not sick compared to the normal people. It's just that, their sugar's a little on the higher side because of their lifestyle, which can be brought into normal. So when their sugar levels are completely normal, they are as good as other individuals. So I would never call them as diabetic patients as such. Yeah.
Right. And actually speaking on the same thing from both your perspectives, what are the 4 or 5 key causes of lifestyle that you think, drive an increase in diabetes or the propensity of diabetes in individuals? What have you noticed in the field that people should keep an eye out that tends to be a driver for diabetes from a lifestyle perspective?
Broadly, speaking, which it includes a lot of things like, it's the stress management and how you sleep and what you eat and when you eat. And there are too many things, getting it. Most important factor in lifestyle, what I would say is diet. It's extremely important that, all individuals focus on diet. And of course, other things like when you eat, what you eat, and, how you eat and things like that. And the next factor in lifestyle is exercise, your physical activity. How much are you physically active? It's very important that, we are physically active throughout the day other than just, exercising. So physical activity is very important. And stress. Yes, stress includes, stress is a new thing now. Everyone whom, even you talk to a kid, they're like, I'm stressed, I've got homework to do, I've got things to do, and, don't disturb me, I'm too busy, and things like that. So stress is something, it's become like part of our lifestyle now.
Right.
So that's one thing. And sleep. Oh my God. I mean, the way kids are using gadgets and the way we, start looking at phones before going to sleep, we watch Netflix and, so we're so involved and so much addicted to technology. I think, that's where somewhere, our sleeping patterns are also getting disturbed because of this. So that's again part of the lifestyle changes, which will give rise to diabetes or high sugar levels or pre-diabetes. Most important factors, I would say. Yes.
And those are so easy and relatable to everybody because it feels like almost all of us experience them. Lack of sleep, lack of exercise, stress and diet. Actually, speaking of diet, Sushma, maybe I'll pose the question to you. What have been your observations in the field looking at patients? What tend to be typical dietary habits that tend to be sort of the root cause from a diabetes perspective? What have you observed?
I would add on to a point what Dr. Pavitra has just put in, like her very, very relevant points, what she has pointed out, which I would 100% agree on. Just in one addition to her point would be even information. Because these days, there's so much of information, which is sometimes, not necessarily true, but people just
misinformation more than information.
Misinformation because of the availability of the easy availability of the information.
Everybody's putting stuff out there.
For example, this happened with me. For example, a patient read that grapefruit is very low in calorie, rich in vitamin C, very good for your digestion, but she misunderstood it as grapes.
Right.
So grapefruit and grapes are two different things.
Right.
So she got misinformation thinking grapefruit, so she bundled up grapes,
Right.
a lot of it.
So she ended
Gaining
up
about
eating a lot of grapes. I see.
2 to 3 kgs unnecessary over a period.
Right.
So that is what I call a lot of misinformation.
Right.
That is one. Yes, vis-a-vis food for the diabetes, what happens, what is my personal experience is, when I come across people and I talk to them, first emphasis is for me is on oil. Because we don't realize, we in India, especially our taste, our palate, it is so much full of, very tasty food. And certainly taste is added on by oil, which you and me cannot deny. Anything fried is tasty. Anything good is tasty. Pakoras are tasty. Bhaturas are tasty. But the point is, oil is the densest form and the surest form of giving you those calories.
Right.
Example, just a teaspoon of oil gives you 45 calories, which is quite a condensed part of calorie. But tell me, how many of us, when we use oil in our kitchens, especially Indian household kitchens, you literally, even these cooking shows that I see now, sometimes I like to watch, literally it will be 1/4 of a karai of oil. They're making that simple sabji, they could have just made in a teaspoon or 2 teaspoons of oil. So that is one thing I've realized. People are not
really oil in their diet.
Too much oil, and they don't have the understanding that why they should not be having. See, eventually when we are talking of diabetes, we are also talking of calories at the same time. It is going parallel.
Okay.
Right? So we have to also take these things. So misinformation on that, misinformation of healthy options. They don't, even if you give them options, they are not sure which one to go. They would prefer a samosa to a steamed vegetable, for example. You tell them you can have a bowl full of, say, a steamed vegetable, rather than going for just one fried or a parantha, for example.
Right.
So, there are different options. So you have to change your taste buds if you want to get to the healthy aspect. That's important. And the third point I would say is the quantity. You could eat everything. You could even try eating a samosa. But instead of taking that one full samosa, take 1/4.
Right.
You're still having
the question is, you have to... It's
portion control. Portion control. Very important.
Understood.
So that's very important.
So from a nutritional perspective, you're saying that, lack of information or actually being sort of overdosed with misinformation is one of the common issues that you observe. Use of oil in your food. So oil makes things tasty. So then you overdose on having oil, but you don't realize how many calories you take in. Yeah. And the third is actually being calorie conscious, in the sense of not having to not eat stuff, but eat it in the right controlled manner. Are all important aspects from a nutritional standpoint that you've observed people are not doing, and therefore is impacting their health. Maybe I'll hand it over to you, Dr. Pavitra, on the next one. Are there early signs? So we have a lot of people across Mishti and global platforms that, much like myself, who have all of these lifestyle issues that you mentioned. But what are the early signs we should be watching out for? Because we wouldn't necessarily go and get our tests done on a regular basis, particularly the young. Would you recommend certain things for both people between the 30s to 50s and 50 above, in terms of what are early detection signs, or how often would you recommend us to do a blood test to check in on our health? What would be your recommendation?
All right. What Indian recommendation is, after above 35, it's always good to get your blood pressure, your blood sugar tested, and even your cholesterol levels. It's very important. It's very important. And of course, there are certain risk factors like obesity. And in women, it's a polycystic ovarian disease or PCOS syndrome. So all these symptoms, and then irregular menstrual cycles, without even having PCOS or PCOD, even irregular menstrual cycles in women. And obese kids, especially, even if they are teenagers, it's always good, they get that. These are the risk factors. We usually get it tested. Once we see in individuals having these risk factors, we ask them to go get a sugar tested. Or as you asked me, what are the early signs?
Yeah.
Early signs would be, sudden loss of weight,
Sudden
increase
loss of weight, not
loss
gain of
of
weight.
weight. Gain of
Interesting.
weight, gain of weight is like, it takes a lot of time, at least 5 years for progression from pre-diabetes to diabetes.
Okay.
It takes a lot of time. So during that period, the individual would have already put on weight, already would have had all lifestyle changes, would have had other stress factors and other things, so that he or she would have already moved towards becoming diabetic. And then once the individual has diabetes, then the symptoms would start, like loss of weight. Loss of weight, majorly, it's because what insulin does is whatever we are eating, it assimilates into our body cells and it stores as fat and it stores as energy. And once there is no insulin, or there is insulin resistance where insulin is not working properly, then they start excreting that extra glucose in their urine.
I see.
And there would be loss of weight. So loss of weight, increased thirst, increased hunger, then, weight loss, as I mentioned. And then sometimes patients don't have, or individuals don't have any of these symptoms. They can just have confusion, tiredness, or they can, sometimes it's just the routine blood test. They've gone and they see the sugars are 300, 400. They're surprised.
Wow.
They don't have any symptoms, and the sugars are so high. So that's where, we have, that's why, we have a protocol where we see the risk factors, go get your sugars tested and your blood pressure tested. And if there are no risk factors, just to be on the safer side, after 35, get your sugars and your blood pressure and cholesterol test. That's the usual recommendation what we have.
Understood. So after 35, it's in any case recommended to get these tests done. And in terms of symptoms, sudden weight loss, thirst, sudden hunger, or confusion, sudden fatigue, those are sort of symptoms to watch out for. Might be a trigger for you to go and consider getting yourself checked up. And if you are sort of preconditioned from a PCOS perspective or having irregular menstrual cycles, again, might be or obesity. You have not sudden obesity, but you have obesity. It may be worthwhile for you to definitely get yourself checked from a sugar standpoint to make sure that you're okay. And I actually bring up a really interesting point, doctor, that it takes 5 years to go from a pre-diabetic to a diabetic. So you actually have a pretty long window to reverse things, pretty long window to fix yourself before things become irreversible or become harder to reverse, not irreversible necessarily. And that's where I think, Sushma, you've had a lot of success with using nutrition a lot more meaningfully in that phase or in that sort of unfortunate trajectory for a lot of these people to bring them back to avoiding diabetes. And maybe just, can you walk us through some of the examples of folks that you've sort of dealt with who've been diabetic? What have been sort of the big dietary changes or sort of, dietary sort of influences that you've had to bring into their lifestyle that have worked well?
These days, the kind of food that we are getting is not in a pure form. It's not an organic food anymore. It's more chemically sprayed food. It is more in a hurry, as well as they want everything, like inject and grow the vegetables overnight.
Right.
And including the milk. To my dismay, I came across this a study which was recently conducted. Not recently, it was conducted quite some time back. Like these cows abroad, they are milked through those machines, basically, the machines are put, and they are subjected to a lot of pain. And then when they found that there are a lot of literally pus oozing out from those teats, and they're mixed in your milk. They get mixed in your milk.
Right.
But in the end of it all, they realized they cannot shut down the industry. It's a very huge money spinning industry.
Of course.
So the recommended allowance of the pus cells is allowed to a certain percentage. That was shocking.
Right. So they allow the cows to have pus cells
in the milk because they don't want to shut the. It's a big industry.
So from your perspective, what are the things that you would say that you've seen? So milk is one consideration. You think milk has been a big driver for people having...
Yeah, that's why I'm coming to milk now. So what I did is, in most of the patients, I tell them that and this I have seen with a lot of the patients, especially even with rheumatoid arthritis people, which is an autoimmune. It's an autoimmune disease where you don't... So once I told them, just delete milk and use any plant substitute milk. Anything. Oats are available. Oat milk is there. Almond milk is there. Cashew milk is there. Plenty of milks are available now. And you can make some milk even at home now. It's possible to do that. With a very easy way. That really helped. That helped a lot. Not only in arthritis, it helped me a lot even in diabetic people. In controlling this sugar. And also at the same time in arthritis, the inflammation that comes in those joints and all that got reduced. The pain subsided and they could feel the change. And then these subjects, they took a little time. They were hesitant because they were used to their coffee with milk. They were used to the chai with milk. But once they started feeling the change after, say, about 15, 20 days only, of leaving the milk and coming to a substitute milk, they were ready to take up. They realized when the pain was less, they realized, there is something to it. So that was one factor. Second factor is, they say in diabetes, you don't have fruits. I realized if you have fruits as smoothies in the morning, including banana, which is a big no-no. If you mix banana, a ripe banana, with any kind of a leafy vegetable, for example, palak, or amaranth, even this, what we call this, methi, fenugreek. And you take a bunch of that and you take a ripe banana, you put water in it. It is a fantastic filler. And to this, you can add some oats, you can add some seeds. So again, it adds on to the bulk. And it gives you a feeling of fullness for a very long time. And your sugar level does not go up, though even if you had very sweet thing, even a mango, for example, because there is a lot of fiber you're also consuming alongside. So that is not giving you that initial spike, that spike. So it reduces sugar in a very slow form. So you don't have those spikes when you're mixing vegetables with something sweet. So that helped. That has helped in my journey of giving weight program and this diabetic program diets to the patient.
Interesting. So milk has been a big no-no, and actually I switched to oat milk about a year ago, and I can personally vouch for how much of an improvement it has both brought to my skin. I used to have acne, and I suffered from a lifetime of acne, which seems to have somehow reversed after I switched to oat.
That is all sorry to do with the hormones that they are.
Yes, it is very. That's the reason why I made the switch, and I can see that even from a sort of energy standpoint, it does definitely have a big impact. And it's interesting that you talked about this study, because there is a big movement happening all over the world where people are starting to switch away from milk for good reason. Maybe I'll come back to you, Dr. Pavitra, more on medicine here. So while Sushma is very focused on using nutrition as a means of reversing in that journey of those 5-year window where we can bring people back, how much of a role medicine plays in reversing diabetes, or is medicine primarily a very strong control in managing diabetes? What are your thoughts?
All right. In pre-diabetic state, when someone has polycystic ovary or polycystic, disease or syndrome, what we do is we usually put them on metformin, where the insulin resistance comes down, and they start absorbing or using the insulin really well, and that's how their pre-diabetic state, their sugar levels can be brought down and the insulin resistance can be brought down. Once you bring down the insulin resistance, then you're stopping diabetes. Only in those special cases we use metformin, and in few places where we see that there is, the sugar levels are a little on the higher side. For example, we call it as impaired fasting glucose and impaired glucose tolerance, where the sugars are between the diabetic range, just below the diabetic range. it's about to reach that range, then we give medications. Otherwise, what Sushma said, I think, diet is the best way to bring or, reverse your diabetic from pre-diabetes to normal. Diet is extremely important. And at the same time, physical activity. If someone has insulin resistance, then once they start walking and once they're physically active, their resistance can be brought down. So it's very important that, exercise also has to be included in the lifestyle change. Yes, medicine does play a role in, the small portion of patients. Mostly it's lifestyle changes.
Mostly it's lifestyle change. Actually, you talk about a really important point. India actually ranks #2 in the diabetes capital of the world. I was surprised to read China is actually #1, but that's just purely because of size. And likewise in India, one of the main reasons that was sort of identified in the article on it was around the sedentary lifestyle. So diabetes is not an issue in the villages, but it is much more an issue in the cities because of the kind of lifestyle that we have. And particularly for a lot of us who have gone through COVID phases, sitting at home and working from home and being on the desk, 18 hours a day, that actually is a tremendous disservice you do to your body. And it is creating a ripe environment for all of these kind of issues to crop up. So physical activity is probably the primary cause of making India the leading nation in terms of diabetes. And it needs to be a combination of diet and exercise to help you bring things back. And every once in a while, for patients who sort of gone past that tipping point, you may need a role of medicine to maintain, so you are able to at least inch your way back. Otherwise, you're sort of constantly fighting an uphill battle. And actually, on the same point, Dr. Pavitra, I'll probably ask you this question, move over to Sushma. What is the latest? There's a lot of technological change when it comes to managing and monitoring diabetes. What are you seeing out there in the field that people at home can use more effectively in terms of keeping an eye on their diabetes? Initially, these used to be blood pricks and things like that, but are there better technology out there now people can consider for diabetes monitoring?
Who are already on medications and they are taking insulin, and if we want them to regular monitor, it's very important they have a glucometer at home. And there are different ways to monitor. For insulin patients, we say thrice a day, and for patients who are taking tablets, we say thrice a week. So it all depends on the targets what we give for patients. It's very important, this is something which they have to talk to the doctor about when they'll have to monitor and, how frequently they have to monitor. Otherwise, mostly some of the patients, a small group of patients, what they have this aversion towards checking their blood sugar levels. They're like, that kind of, makes them,
stresses them out.
Panic. Yeah, stresses them out and, they panic. And so that's when, you'll have to explain them, it's fine, it's okay. If your sugar levels are high, there's nothing to worry. Sometimes what happens is, biology, it's not like maths. You take insulin and you take tablets and then your sugar level has to come down. Sometimes there are other factors. There are hormonal changes. There are stress factors. You wouldn't have slept last night well, so your sugar levels are high. So there's nothing to worry. Just check it, note it down. Every day, even in normal individuals, our sugar levels vary. So you'll have to sit and talk to the patient, tell them about, it's all right if the sugars are high on, in a day or twice a week. It's fine. Just monitor and regularly, note it down somewhere. And, when you go to your diabetologist, just tell them about it. And mostly now we focus on HbA1c. That's the last 3 months average. That's more important for us. And at the same time, what is now more, apart from HbA1c is like the peak, how it's going.
How high does it go?
How low does it go? It's very important that we see the fluctuation. Fluctuation is also very important here. So apart from just one-time monitoring sugar levels, we'll have to talk to the patient about it. And it's always good, they have a glucometer at home. And sometimes what happens is when there are infections, even mild infections like cold or cough or fever, sugars tend to go low or very high.
Right.
And it's very important for them. And during that phase, they measure their sugar levels regularly.
To understand the importance of catching this early, controlling it early and reversing it early, because I think there's part of lack of understanding. And to be honest, until we sort of researched it, I researched diabetes a little bit more in depth, I didn't know of the consequences, absolute devastating consequences of having diabetes. Somebody living with diabetes, and without necessarily controlling it and managing it well, is, walking into a disaster. And if you can highlight some of the, issues that can happen to your different parts of your body and you physically as being a diabetes patient, what would be the 2 or 3 things you would highlight?
All right. We categorize into 2 important complications. One is microvascular, the other one is macrovascular. Micro is something which affects really small blood vessels, the tiny blood vessels, which are in eyes. So we call it as retinopathy. And in the kidneys, we call it as diabetic kidney disease. And in the nerves, we call it as nephropathy. So these 3 are extremely important, whenever a diabetic patient walks in for the first time. I mean, all my patients, first time when they come, I almost take 45 minutes for the consultation, telling them about the complications and telling them, why are we treating diabetes in the first place? What happens if your sugar levels are high in your body? It's very important for them to know and educate them about, why diabetes has to be treated and why they should be more careful in taking care of their sugar levels. Absolutely. And apart from that, my macrovascular complications, which affects your heart and major blood vessels in your legs and brain. So it's very important that, they take care of they regularly go for checkups, ECG or echocardiogram when it's required. And go for the regular, we call it as Doppler study for the legs to make sure the blood circulation is fine. So, so it's very important that they get these tests done once in a while. We usually prefer once in a year.
Okay.
If there are no complications, just to make sure that, everything is fine. And if there are any complications starting at a very early stage, we can catch them and then start treating them at an early stage. And we can actually even reverse them if your sugar levels are under control. And apart from that, of course, if they have complications, then we do more frequently, maybe once in 3 months, once in 6 months, based on, the type of complication they have.
How complex. Absolutely. And I think that's the other thing that we've been trying to emphasize a little bit more, particularly with our audience, which is get the information, maintain your data, and get the checks done. You don't have to, again, depending on the level and extent to how far you are already in your diabetes, these checks don't need to be done that regularly. Once a year is good enough, but the idea of at least doing it once a year is that you know where you are in the journey and you have the ability to change course. So again, especially with 50 plus members that we have at Mishti that we're trying to support in terms of their health and lifestyle changes, we are emphasizing the importance of them getting a regular health check done. I think in India, traditionally, we have shied away from getting health checks done because we feel either, everything is under control, and we tend to be much more reactive rather than proactive. But again, it is so much wiser to know where you stand so you can course correct before you end up, walking blindly into diabetes, heart disease, other issues, kidney failure, and things like that, right? You don't want to get it to a point where it becomes harder to reverse, if not impossible to reverse. So again, highly emphasize and recommend to folks listening here, especially if you are obese, have any preconditions, and or are 50 plus, please take good care of your health by getting yourself checked at least on an annual basis, so you know where you stand. You can be a lot more proactive about changing course for your health in your life. Yeah.
Like, for example, we need to we need to educate people not to keep themselves starved for a long period of time. Right. Normally, people have started missing on their breakfast for these long hours or just going straight for lunch, but not realizing when they go for a meal next, if they're starving, they tend to eat much, much more. Right. So very important not to skip your meals. I would emphasize that one. Second, very important is that, keeping salads as a part of your meal and keeping smoothies as a part of your meal is very, very important. And even sprouts for that matter as a part, because these are what give you alkalinity in your body. Now, of latest, if you would have seen the latest trend that is happening, at least I've seen it in these magazines, they're selling this black water, magic water they call, in a bottle, which is supposed to be an alkaline water. And the bottle is being sold for about I think 200 rupees or 300 rupees, and all these film stars are carrying them in their hand. You see them coming out from the gym and carrying those water. It's really not required. If you just put lime, squeeze lime in a jug of water, and you add on some curry leaves to it, or add on some mint leaves to it, water does become alkaline easily in that form. So you can have, and you can use an earthen pot. That also helps a lot. Fermented food is another factor I would lay emphasis on, fermented food, because it's already pre-digested. So again, you're getting live organisms into your body, and it's good. It's good for your health. So, and incorporating these small things like what our grandmothers and mothers, we had achar, we had chutney. These were all precursors to good health. They were keeping your body in an alkaline mode.
Interesting.
And most of the diseases that come our way is if your body is more on acidic side. That's why we say we lay emphasis when we take more of animal protein, on animal, that gives you rise to an acidity, to more acidic base in your body.
I see.
So that's why you have to reduce that to the extent that you remain alkaline, and the diseases are not going to shoot you so much.
Summarize very quickly, because I think you've given some very interesting health tips here. So you talked about milk first, so in trying to sort of swap that for healthier alternatives, plant-based alternatives. You talked about fermented food, which helps a lot in terms of having pre-digested food. And you talked about adding smoothies and salads on the side. And actually, it's a very popular diet that we have abroad, but not as much in India as one would like to see. But they're actually delicious to have, like great salads and smoothies on the side.
Have chutney, for example, coriander chutney hai, mint chutney, or even, for example, you have this muli chutney, simple things like that. That is also a part of adding on to the alkalinity in your body.
Excellent.
And also at the same time, soups. Before you go out for dinner to somebody's house, please make sure your belly is full. You have a bowl of soup, you eat a plate of salad or something before you go for a dinner or something, or sprouts.
It's a great way to keep your portion control afterwards, because otherwise you'll hog.
That does help. That does help. A lot of people cannot be vegetarian. They've not seen the way to that. So non-vegetarian is a part of their growing up. So you can't just tell them to switch. It gets very tough. But they could reduce it, the portion. They could control the portion A, or they could use it in twice a week, or instead of having it all day, so something like that, and add on some grilled vegetables alongside the meat and all that, and make it more healthy.
Absolutely. And the last point that I wanted to add to your summary was don't skip meals. Again, starving and then jumping onto the next meal with a hungry base only adds to your problems, because you're trying to overeat. But no, I think this has been very, very helpful. Thank you so much, Dr. Pavitra. Thank you so much, Sushma, for sharing fantastic information and wisdom here. And as we talked about earlier, at the start of the program, we are launching a Mishti Diabetes Reversal Plan with both Sushma and Dr. Pavitra involved in helping you manage your diabetes, course-correcting you back to good health, course-correcting you back to active life. So please, if you have diabetes or have somebody who you know that you love who has diabetes and would benefit from, a fantastic program with two incredible women leading charge of helping your health get back in shape, please reach out and we'll be more than happy to help. With that, please enjoy the festive joys of Diwali. Wish you great health, wish you great happiness, and thank you once again for joining us today.